Welcome to this topic, health. So this topic is going to be discussed in just a single video. Most of the information in here you already know because diseases are a day-to-day thing in our lives. So most of the information you already know, but you're just going, to prepare your minds for what is expected of you. So health is defined as a state of physical and mental well-being. Physical and mental well-being. That's what health is. A disease is any physical or mental disorder that interferes with normal functioning of the body and has a characteristic set of signs and symptoms. So it has a characteristic set of signs and symptoms. What is a sign and what is a symptom? A sign is any indication of a disease which can be observed or measured, e.g., a rash, a high temperature, loss of weight. So that's what a sign is, things that can be measured. Okay, what about a symptom? So a symptom is any indication of a disease that can only be felt and described by a patient but cannot be measured with easy, e.g., headache and other kinds of pain, nausea, dizziness, and the likes. How can you measure dizziness? Okay, so that's the difference between a sign and a symptom. A sign is any indication of a disease which can be observed or measured, while a symptom is something that a patient feels. So there are groups of diseases. There are two types of diseases in terms of grouping. So these are infectious diseases, also called transmissible diseases, and non-infectious diseases also called non-transmissible diseases. So we're going to take a look at infectious diseases. Then after that, we'll go and we'll take a look at non-infectious diseases. So, infectious diseases are those diseases that can be transmitted from one person to a person. They are also called pathogenic disease because they are caused by pathogens. So, actually, all infectious diseases are caused by pathogens. Hence, they are called pathogenic diseases. So what is a pathogen? A pathogen is just a disease-causing organisms, mainly microorganisms, meaning small organisms, e.g. viruses, bacteria, fungi, and worms. So how do infectious disease spread? They can spread through vectors. We discussed vectors when we were talking about life cycle of a mosquito and a housefly. So a vector is a disease-causing agent that carries diseases from one organism to another. Okay, so they can be caused through vectors. They can be caused by inhalation of infected air droplets. So if someone is sick, then they cough, for example. So the air droplets have come out of their bodies, and if someone inhales those hair droplets, you can get the disease. So examples of such diseases which are caused by inhalation of infected air droplets include tuberculosis, pneumonia, influenza, measles, and diphtheria. Another another method of spread is taking contaminated food and water. So if you take contaminated food and water, you may have this. So this contamination can come from maybe there was someone who had that disease and somehow they were the food was exposed to them. Then you take that food, so you can get that disease also. So examples of such are cholera, typhoid, dysentery, intestinal worm infections, and hepatitis A and hepatitis B. Then also contact with infected water. So an example of such is bilharzia and hookworms. Some of the diseases we might not know, so we're going to go into them to understand just a few of them. Also, contact with infected organisms, e.g. ringworms, arthritis foot, and thrush. These are some of the diseases that can come as a result of being in contact with infected organisms. Also, sexual intercourse, e.g. gonorrhea, syphilis, and AIDS. So if you are involved in sexual intercourse with someone who has these diseases, you can also get the diseases. So these ones which are spread by sexual intercourse are called STDs or STIs, sexual transmitted diseases or sexual transmitted infections. So we're going to use this table just to discuss some of the diseases. So here in red we're going to have diseases, then here we're going to have causative agents, that's organ or pathogens that cause these diseases, then signs and symptoms, method of transmission, treatment, and method of control. So we'll start with bilharzia, which is also called schistosomiasis. So schistosomiasis is caused by a pathogen called schistosoma. Okay, so the signs and symptoms of bilharzia is you can have anemia, you can be feeling tiredness all the time, and blood in urine and in feces. So the method of transmission is when you're exposed to a Zechariah larva in water. So bilharzia, I think, according to my experience, I've seen it in young children, especially those who used to swim, in those um, dead waters, or maybe at village, the rivers and the likes. Okay, so if someone with bilharzia had urinated in that river, it's possible that that river is going to have this Zechariah larva. So if you're exposed to this, you can have bilharzia. So what is the treatment and methods of control? So there should be sanitary disposal of urine and feces. There should be boiling or treatment of water before use. Also, the ultimate one, treatment with drugs. Okay, so this bilharzia, the blood and the in urine comes because when you're about to urinate, if your body has the schistosoma, if it has laid eggs, the eggs have hooks. So when they are taken out of your blood into the urine, when the urine is about to come out, those hooks are going to be scratching on the hose of your urinary tract, thereby injuring them and causing blood. Therefore, you are going to urinate blood. Okay, next is AIDS, which is short for acquired immune deficiency syndrome. So this is caused by a virus called HIV, or human immunodeficiency virus. So the signs and symptoms for AIDS are loss of weight, skin cancer, tiredness, opportunistic infections such as pneumonia, tuberculosis, and diarrhea diseases. So the thing with AIDS is it attacks your immune system. Your immune system is the one that protects your body against infections. So when it is attacked, then it's going to be weak and you can easily get any disease. So method of transmission includes sexual intercourse with an infected partner, contact with infected blood, and the most tricky one is mother to child transmission. Then treatment and methods of control of AIDS include avoid unprotected sex, be faithful to one sexual partner, avoid sharing piercing and cutting utensils, screening of blood before transfusion, and the problem with AIDS is there are no drugs to deal with it. Okay, we have the ARVs, which can just help to sustain the lives of an HIV AIDS patient, but we don't have a cure for it yet. So next we look at malaria. So for malaria, it's caused by a pathogen called a protozoan called Plasmodium. So this is the pathogen that causes malaria, Plasmodium. Okay, it is connected to mosquitoes, so they are carried by female mosquitoes. When you are bitten by a female Anopheles mosquito, then you are going to have malaria. So signs and symptoms: headache, fever, anemia, pain in muscle and joints, shivering and sweating. And method of transmission, of course, is by from female Anopheles mosquito, like I've said. Then treatment and methods of control for malaria is you can have treatment with anti-malaria drugs, controlling or cleaning of mosquitoes, preventing mosquito bites. So this one we discussed it when we were studying life cycle of a mosquito. Okay, the last one is cholera. So this is caused by a bacterium called Vibrio cholerae. Vibrio cholera. So the signs and symptoms of cholera includes vomiting and diarrhea, um, where you have rice water like stew, and dehydration. So method of transmission, when you take contaminated food and water and contact with infected person. That's the reason why cholera um, is rampant in rain season, because it usually spreads through water and of course food. Then treatment and method of control include sanitary disposal of feces, boiling or chlorination of drinking water, homing and covering of food. And if there's a person with cholera, better they are quarantined, because cholera spreads very fast and it is very deadly. So, just to understand how the disease transmission cycle is, we're going to take a look at schistosomiasis, which is bilharzia. So, if a person with bilharzia urinates in water, so the ova deposited in urine or feces. So, this ova is going to develop till it becomes, as it is developing, it's going to become a host on a snail's body. So as a snail is moving, it will be carrying these. Okay, so it's going to spread in the water. So as this is happening, it's going to develop into the larva stage, which is where it's going to be called a cercaria. So this cercaria, once it is exposed to someone else who is healthy, it's going to penetrate through their skin. Once it penetrates through their skin, it's going to develop in the bladder or intestines. Okay, the worms of this are going to develop in the blood or intestines. So once they develop, if of course they are going to pay and they'll start having kids, so to put it, they are going to start mating and there will be eggs. So when you're about to defecate or to urinate, the eggs are going to be coming out, but they will be because they have hooks, so they are going to be destroying the lining of your urinary tract. Okay, thereby causing the urine to come out with blood, or the feces to come out with blood. Okay, that's how the disease transmission cycle of schistosomiasis is. Next, look at non-transmittable diseases, which are diseases that cannot be passed from one individual to another. So once you have it, there's no way you can give it to another person. Okay, they are divided into the following categories. The first category is the nutritional deficiency diseases, the ones we discussed during nutrition. So diseases caused these are diseases caused by poor diets lacking one or more of essential nutrients. Examples include marasmus, when you don't have a lot of carbohydrates, kwashiorkor, when you don't have proteins in your diet, and rickets, when you don't have vitamin D, calcium in your diet. Then we also have degenerative diseases. So these are diseases characterized by a gradual decline in the function of an organ as a result of aging or too much stress on the organ. Okay, it can be arthritis or coronary heart disease because of age, or maybe because you are stressing the organ that much, it's going to start performing low in terms of its function. Okay, so these are degenerative diseases. Next are environmental diseases, which are diseases that result from the presence. Environmental diseases, sorry for that. Environmental diseases are diseases that result from the presence of pollutants in the environment, e.g., bronchitis, emphysema, lung cancer, and the likes. When you have lung cancer, there's no way it can be transmitted to another person. It is caused by environmental factors. Then we also have mental disorders. So these are disorders of the mind caused by chemical physical factors, e.g., schizophrenia. You can also maybe you were involved in an accident, so your brain was injured. You are going to have a mental disorder. Then there are also self-inflicted and social diseases, which include conditions like drug addictions. Okay, so these are just self-inflicted and social diseases. So last we look at immunity. So immunity is just the resistance of the body to infection due to the presence of antibodies in the blood. So the antibodies are the ones that fight against infections. So they are always scanning the blood, making sure that there is no any foreign particle. If there is a foreign particle, they are going to look at the antigen of that particle. Then there are the antibodies that are trained to deal with that antigen are going to deal with it. So each type of antibody is only effective against one particular type of antigen. Now there is a catch. The body can only produce antibodies against an antigen that it has been exposed to. So if you have never suffered from a certain disease, okay, then you somehow found yourself maybe you get you have that disease, then the antibodies you may not have them for that disease. Okay, so the body has to be exposed to a disease for the antibodies to be created that are going to deal with that disease. So this is why it gets a bit interesting. So let's look at types of immunity. So basically, we can classify immunity in terms of active or passive. So immune is said to be active if the body is involved in the production of antibodies, and passive if the body receives ready-made antibodies from an external source. Okay, so if the body makes antibodies, that's active. It actively participates in the making of antibodies. Passive is where it's not doing anything, then antibodies are just introduced in the body. Okay, we can also categorize immunity into two ways. The manner or the way in which those antibodies the means in which those antibodies are introduced in the body. So we can have both active and passive immunity can be natural if acquired through natural means, such as getting infected, breastfeeding, or across the placenta from a mother to an unborn baby. So if the mother's antibodies go into inside the body of a baby who's not yet born, then new antibodies have been introduced in the baby to protect that baby. It's not the body of the baby that's making antibodies. So that's natural immunity. Then we also have artificial if acquired through man-made means, such as vaccination or immunization. Okay, vaccination is where a vaccine is introduced in the body. So a vaccine is just a weak form of a particle that can cause you a disease. So it's a weak form of a pathogen that can cause you a disease. So this weak form, once the body will know that there is a foreign particle, antibodies are going to be created and they're going to be trained to deal with that disease. Okay, so it's weak so it doesn't attack you. Okay, that's vaccination. Well, immunization is just is where antibodies that are trained to deal with that particular disease which you might not have suffered are introduced in your body. So we can have a combination, natural, active immunity. So active, it means the body is involved, and natural, the manner in which these antibodies are introduced is a natural manner. So the definition or description is the body gets naturally infected and gets stimulated to produce antibodies against the infection. So in case you get sick for the first time, you are sick of a disease that you have, it's like it's your first time, the body is going to create antibodies to deal with that disease. That's a natural, because it's a natural mean. You are sick of that. It's not like it's intentional. No, so it's a natural mean. Then since the body is involved, it's active. So example, a person becomes permanently immune to measles if they have suffered from it before. Okay, so measles, you can only suffer it once. So if you suffer it next time, you won't suffer it. Then we can have artificial active immunity, in which dead or weakened germs or antigens are introduced into the bloodstream of a person so as to stimulate production of antibodies by the body. So this process is called vaccination. Okay, example is the BCG vaccination against tuberculosis, polio vaccine, cowpox vaccine. I think for polio and I think chickenpox, it was one of those famous vaccination programs that were done in Zambia when we were young. There is also natural but passive immunity. Natural but passive. So it's natural, but the body is not involved in making antibodies. So this is where ready-made antibodies are introduced into the bloodstream of a person through natural means, such as breastfeeding or across the placenta from mother to an unborn baby, to give immediate but temporal protection against particular antigens. So this is natural passive immunity. The last one is artificial but passive immunity. So artificial passive immunity is where immune serum containing ready-made antibodies is injected into the bloodstream of a person to give immediate but temporal protection against a particular disease. Example, we have antivenom or anti-tetanus injections. So these are different types of immunities. Okay, natural active immunity, artificial active immunity, natural passive immunity, and artificial passive immunity. The key idea to understand them is to know what natural, what artificial, what active, and what passive mean. Then the combinations, you can get the concept. So what's the importance of immunity? Immunity basically is important for prevention of diseases. Factors that reduce immunity include poor diet, development of resistant strains of pathogens, repeated invasions by pathogens, intake of immunodepressant drugs. So these are drugs that that affect the immune system negatively. So if you do this, you intake immunodepressant drugs, your immunity is going to be reduced. Infection by HIV, like I explained, that destroys the lymphocytes. So this marks the end of health. Happy solving.